Let's get to work. Let's look at the person first, pain second. Let's solve big problems for patients. Let's ensure that we're nailing their dream outcomes. We're increasing their likelihood of achievements. We're decreasing their time delays, and we're decreasing the effort and sacrifice for our patients so that we can always give them more in value than we take in payment. Hey, welcome to the Go-To Physio Podcast. My name is Dave O'Sullivan, and in this podcast, my aim is to give you 15 years of my experience in professional sport and private practice and share that knowledge so that you can get real-world results with your complex patients who have failed traditional approaches. I hope you enjoy the show. Hey, welcome to the Go-To Physio Podcast. My name is Dave O'Sullivan, and today we're talking about the 13 steps to a great subjective assessment that gives you the confidence to make sense of your patient's symptoms and help your most complex patients progressing. Today it's a HPP episode, it's a happy progressing patients, and in terms of the book we're actually on page 86, okay, so 85, 86, chapter 5, we're talking about making sense of your patient's story and having confidence and clarity in your treatment plan, okay? So the subjective assessment, I say here on page 85, it's the most important pillar of the 8 where all the answers lies to your patient's problems, okay? So if you're really struggling with a patient, go back to the subjective assessment, okay? Strategy is 80% with complex patients. Your tactics is 20%. I think it was Einstein that said, you know, if I had an hour to solve the world's problems, I'd spend 59 minutes defining the problem to be solved and then 1 minute solving it, okay? The strategy is all in the subjective assessment. It's so important. Your subjective assessment is where your treatment plan is actually built out as well. It's that important. So in terms of the 13 steps, I'm not going to go into every single step in a lot of detail here because I cover these quite a bit from page 87, like all the way through to 95, we're going to 97, we're going to page 100, okay? So I cover this in quite a bit of depth in the book, but to start, the 13 steps. Step 1 is you have to establish authority and rapport. Now, I said this on a mentorship coaching call recently as well to the therapist, is rapport and authority, it's almost like a seesaw, okay? You need to have rapport with patients, but you don't want to be so friendly that the patient starts leading the treatment plan. And that's where authority comes in. So first impressions are really important. So the key components of rapport and authority, you know, I talk about in the book, like eye contact, smile, tonality. One of the biggest things is like, think about a world-class heart surgeon or brain surgeon. Like they're calm, they're confident, they reassure you, their tonality, it's good, they speak slow, they pause, probably, you know, and they're very confident. Whereas a lot of therapists, high-pitched voice, you know, schoolboy, schoolgirl tone of voice, lack of eye contact, very nervous. Like, is that somebody who is demonstrating, you know, you are in the hands of an expert who's going to take care and solve your problems, okay? It's probably not. So again, I don't need you to be a robot, you know, and completely change your tonality or anything like that, but just be aware of that, okay? And actually, when I looked at the literature, and you look at the literature, look at like patient-centered approach, one of the components there, I think it's a Mead paper, 2002, spoke about this in the mentorship coaching calls recently, like it's your own awareness of your own behaviors as a therapist. That's something that we want to take into consideration. So that's one where you have to get the balance between rapport and authority. You want to be friendly with the patient, but you still want to be in control of your sessions, okay? So step 2, so step 1, have balance between rapport and authority. Step 2, make the patient feel understood, accepted, safe, and in control, okay? So again, that's a bit of a mouthful. So what I mean by that is, in terms of our patient, they have 4 basic human needs. They want to feel understood, accepted, safe, and in control. So what I do with that usually is I make them feel safe and in control, where I'll sit them down and go, okay, here's what's going to happen in the session. I'm going to ask you a few questions. Then I'll ask you to do some simple movements. I'm not going to ask you to do anything you're not comfortable with. We're not going to flare your pain up or anything like that, all being well. And then after that, I'll explain what I think the problem, solution, and plan is. And then you'll have an opportunity to get your questions answered. And then if we feel appropriate, we'll start with the treatment plan. And I'll give you a few things to go with. Does that sound okay? So again, even just setting the scene and setting the expectations is taking the fear of the unknown away, okay? Step 3, identify the most important thing the patient wants from the session, okay? So with that, there's a formula here, again, that I say you want to memorize. Patient's level of happiness is current reality minus expectation. So that's the power of step 3. What's the most important thing the patient wants from the session? So we identified this when we came out of lockdown, where we notoriously here attract a lot of patients who have failed traditional approaches. So they really want to understand what's the root problem, what's causing my problem. But after lockdown, we actually got a lot of patients who were in acute pain, and we identified actually some of these patients, they were in pain. They didn't really care what the root problem was. They just wanted pain relief, okay, in the first session. So that's where, what you want from today's session. Now, usually your patient's going to say, oh, I'm in agony, I just want pain relief. Or the other type of patient will say, I want to know what's causing this problem and how to get rid of it once and for all. So for us to explain the problem, solution, and plan to a patient who's in a 9 out of 10 rage and pain here, it's probably not the best thing. So helping her set expectations, giving them some pain relief, and then answering the 4 questions, that might be a better strategy. So that's where really, I think it's important that we understand what the patient's wanting from this session. So then you can actually go and give it to them. The next thing, step 4, is we want to establish the internal problems that the external problem is causing the patient. So the external problem is your back pain. Internal problem is the things that the back pain is stopping them from doing. So what are the problems that the back pain is causing? Because they're the things we need to solve to give more value than we take in payment. Okay, so the back pain has stopped me doing my gardening, lifting my kids, sitting at my desk pain-free. But straight away there, you've 3 things that you can solve that's going to be really valuable to your patient in everyday life. So straight away now I know what hands-on treatment is going to help that, what rehab exercise options will potentially help that as well. Okay, and that can give value to patients. But I also know what I need to assess when I actually go into the objective assessment. Okay, so what's the pain stopping them from doing? How is it affecting their daily life? All of these things are really good. And there's a few other things I put in here on page 91. The next thing, step 5, establish mechanism of injury. That's going to help us, if we remember from previous episodes, the value equation, and decreasing the time delay where the patient can feel a difference. The mechanism of injury is actually really important. So that's where we're going to understand what potential peripheral tissues, there might be some protective tone, the nervous system may not be now happy to tolerate load. We know we've Golgi tendon organs in the muscles. One of the function of the Golgi tendon organ, the muscular tendinous junction, is to inhibit the muscle if we think there's a threat present, okay? So a perceived threat. So there may be something there that we may need to stimulate these Golgi tendon organs through rehab or whatever, or hands-on, in order to reassure the nervous system it's safe, okay? Or certainly if it's not Golgi tendon organs, then stimulate the receptors. So then step 6, we want to establish the aggravating and easing factors. So again, that's going to tie into what peripheral tissues we may want to focus on, but also back to solving problems. Step 7, we want a clear timeline of the patient's previous physical and emotional stressors. So again, this is going to help you make sense of the symptoms and why these symptoms are here in the first place, and potentially more adaptations that have happened. Step 8 is we want to identify any potential objections or tripwires that could sabotage the successful outcome for the patient. So again, what have you tried previously? What helped? What didn't help? Is there anything that makes it worse? So why I say this is that, and actually in page 94 I mentioned the most dangerous and difficult objection of all is the hidden objection. So again, we might say to a patient in the treatment plan, okay, so this is the problem, this is the solution, this is the plan, we're going to do some massage, we're going to do this, we're going to do that. That patient may have tried massage before and it may not have worked. Okay, so for you to understand that, so then when you say, I'm going to do massage, you need to differentiate how your massage is different or what your massaging is going to be different, okay, in order to get the buy-in and the adherence. So that's just one example of why this is important. Step 9 is identify the patient's current perceived likelihood of achievement. Okay, so again, a powerful question here for that might be, on a scale of 1 to 10, how confident are you that this problem will get sorted once and for all? Okay, so again, a lot of patients, they don't believe they can get back pain free. So knowledge is power to a point here if we can apply it in the real world, okay? But ultimately knowing what the patient's beliefs are is really important, because then we can understand how much education, how much stuff here we need to actually solve, okay? So step 10 is identify the opportunities in the patient's life to start fast with your treatment plan, allowing you to add value immediately with the least amount of effort and sacrifice possible. So where are the opportunities throughout the day? So what we're looking for here is the patient's essentially typical day. What does a typical day look like for you? What are the activities you do repetitively throughout the day? stairs, standing, sitting? What are the most stressful parts of the day? What are the least stressful parts of the day? All very powerful answers and information that you're going to gather to allow you to design a treatment plan where you can design rehab exercises with least effort and sacrifice and increase the value to the patient by decreasing the time delay where they can feel the difference throughout the day. Okay, so again, very high quality questions that are giving you real good information to design treatment plans that give more value than you take in payment. Step 11, rule out red flags. Okay, now again, you could argue this probably should be step 1 or 2, but naturally as you kind of start the conversation with patients, the first thing you want to do is establish rapport and authority. You don't want the patient to come in and go, have you got this, this, and this, and this? You have to establish rapport and authority, and then naturally you'll start to rule out red flags as you start to understand their story, their history, and also their 24-hour pattern as well. Okay, so again, common red flag questions. I'm not going to teach you to suck eggs with that. Okay, step 12, be aware of yellow flags and understand the patient's medical history and current medication. So again, what do you think is the actual problem is another powerful question for yellow flags. Again, if they're saying, oh, well, the chiropractor told me the disc is hanging by a thread in one bad move and the disc is going to explode. And again, I apologize to chiropractors, that's unfair. Chiropractors there. So, you know, it could be a physio said that or a massage therapist, anybody, okay? So, you know, that's going to give you real good insight. Actually, I need to probably do a bit more pain science here. And I want to, again, with pain science, it's not necessarily, you want to be careful with that. You don't just tell them, oh, the pain's in your head. It's not. We want practical and systematic ways of delivering that message. But that could be an example there where we know we have a little bit more work to do. And then step 13 is recap the patient's story so they feel understood and heard, okay? So I think that's actually really powerful for 2 fronts. So when we recap the patient's story, they know, and again, if you go back to making the patient feel understood, accepted, stay safe and in control, that's going to be another bit where they feel heard, okay? So recapping the patient's story to them, okay? So let me just get this straight, Mary or John. You've had back pain for 6 weeks. It came on initially when you were doing whatever mechanism of injury. These are the things that aggravate it and ease it. These are the problems you're having because of the back pain now. This is where you want to get back to, and this is what you need to do, want to be able to do. You've tried massage, blah, blah, blah. Previously, you think that it's this. You have confidence that it's going to get back. What else we missing here? You don't necessarily need to say the red flag stuff, you know, unless you wanted to mention that to them. These are the times of the day that, these are the types of activities you do throughout the day. This is the most stressful time of day. This is the least stressful. These are the medications you're on, and this is what you think is going to happen. And did I miss anything else? So just going through that process, it really makes them go, God, this person's actually listened to me and they understand me. Now, the other beauty of that is as you're saying that, it helps you focus as well, okay? The amount of times that I've done that recap and then the answer almost pops into my head of what's causing the problem, it's quite cool because your subconscious mind's going to work then as you're talking. Talking it out loud is a way for you to get your subconscious and your conscious in sync essentially. So saying that to the patient, it not just helps the patient, I actually find it helps the therapist focus a lot. And then that gives you a lot of clarity going into the objective assessment so you can start making sense of the objective assessment, okay? And then just to finish, the last point 98, page 98, the answer always lies in the patient's story, okay? So as you can see, there's a lot more to the subjective than you or I were probably taught at university, okay? Asking these questions forces you to stay focused on the person in front of you rather than just the site of pain. Your patient will feel heard and understood and get invaluable information for the objective assessment. If something is not making sense in the objective or with the patient, the answer will always lie in that subjective, so you'll always want to go back to that, okay? Before progressing to the objective assessment, you must have ruled out red flags. Be clear on the following 3 things in order to design a meaningful objective assessment that gives information required to design and deliver a value-based treatment plan. And those 3 things are a clear timeline of previous injuries and stressors, what the pain is stopping them from doing, the problems, and then where they want to get back to. So then you can bring your objective assessment and actually assess these things. Okay, so rather than just going through a generic objective assessment, you can actually assess now previous injuries, how they're moving with those. You can also assess what the pain is stopping them from doing because that's going to be one of the things you're going to have to solve. And then where do they want to get back to? What does that look like in terms of movements? What's not doing its job? Okay, so really, really powerful questions The quality of your life will be dictated by the quality of questions you ask yourself, Tony Robbins. Okay, the quality of your results with complex patients may be dictated by the quality of the questions you're asking in the subjective assessment. David O'Sullivan, 2023, bastardized from Tony Robbins. Okay, so to recap, step 1, establish rapport and authority. Step 2, make the patient feel understood, accepted, safe, and controlled. Step 3, identify the most important thing the patient wants from the session. Step 4, establish the internal problems, the external problem or back pain is causing them or whatever it is. Step 5, establish mechanism of injury. Step 6, aggravate needs and factors, identify the most valuable problems to solve. Step 7, get a clear timeline of previous physical and emotional stressors, and I didn't mention emotional stressors there. Okay, they're really important to understand as well. Step 8, identify any potential objections and tripwires that could sabotage your success. What have they tried previously, etc. Step 9, identify the current perceived likelihood of achievement. Step 10, identify the opportunities to start fast with your patient. What does their normal day look like? Step 11, obviously rule out red flags. Step 12, be aware of yellow flags and patient's medical history, current medications. That may give you an insight also into emotional stressors, okay, if they're on antidepressants or something like that as well. Why? Okay. And then step 13, recap the patient's story so they feel understood and heard, but also so that it helps you get everything and connect the dots. I can't emphasize enough how powerful it is recapping the patient's story. Okay, that's it for this week. If you got value from the show, there's no advertisements or any of that nonsense. Okay, it's just literally content that you can apply in the real world. If you got value from the show, please share it with a colleague. Hey, I think you'd enjoy this. The only people at the end of the day, or the people that are going to benefit the most, is patients who are living in pain who have failed traditional approaches. The more therapists we can have clarity and confidence with, that love their jobs, that have passion, that aren't falling out of love with their profession, the more people we can help that have pain who have failed traditional approaches. Okay? If you enjoyed the show, as I said, feel free to leave a review. Would really appreciate it. Also on iTunes, Spotify, or wherever you're listening to this. And as I said, don't be afraid to share it with colleagues. If you want to get your questions answered in the show, head to thegotophysio.com/questions. If you want to pick up a copy of the book, you can get that at thegotophysio.com/book. If you are a therapist who isn't quite ready for the mentorship program yet, then a special project that we're launching shortly, thegotophysio.com/members. Or if you want to get all of this sorted, you want to put all the nonsense to bed, you want to get this sorted in the most simple and direct path, then head over to thegotophysio.com/mentorship, and we'll have a chat. We'll see if the mentorship is a good option for you, and if we can help you transform your clarity, your confidence, to then ultimately have more structure in the system to help your most complex patients progress and help you become that go-to physio. Okay, that's it for this week. Let's get to work. Let's look at the person first, pain second. Let's solve big problems for patients. Let's ensure that we're nailing their dream outcomes. We're increasing their likelihood of achievements. We're decreasing their time delays, and we're decreasing the effort and sacrifice for our patients so that we can always give them more in value than we take in payment. I'll see you next week.